If I can talk about my most recent experience, I've had anxiety on and off most of my life, but I've always been instinctively aware that it isn't integral within me. It was from an outside force that brought that anxiety on. It wasn't, I didn't ever feel right saying it's just your chemistry. It never kind of felt right for me. But this is, you're talking 20 years journey for me, really. And then more recently, I had a very traumatic incident with my son, which resulted in me coming into this phase of anxiety that I've never experienced before. It was debilitating. It was raw. It was really very scary for me because it was a place I'd never been before. So there was a few days in bed and a few days thinking, oh God, well, you know, I'm going to try and do this on my own, etc. I've got 2 young children, so I haven't got that ability to just, you know, have that time. So I did go to the GP, who really wanted to help, genuinely wanted to help, was coming from a very good place, prescribed me antidepressants, also gave me diazepam to help while the antidepressants kicked in, said it's anxiety. Some people have anxiety all their life. It comes in waves. It can have bad bouts. Good, you know, you can be, because I said most of the time I'm fine. I'm absolutely fine. And I was referred to the intensive home treatment team, who you're on your phone line to 24 hours a day, which was fabulous. It was really good care. What she did say was, I would recommend, for the sake of yourself and the sake of your family, that you stay on these, because obviously you're someone that's just susceptible to anxiety, etc. Which, you know, obviously you don't want to hear, and especially I don't want to hear. So I went away, took the tablets, started to feel a little bit better, but it didn't go away. There was something, I was back to a functioning level, but there was something within me that was just, there's something not right. There's something really not right. I saw 4 doctors over this time. I saw a psychotherapist who also said it's anxiety. All these people were great people, doing their job, doing their best, coming from a very genuine place, so I'm not dismissing the work they do. But instinctually I just knew it wasn't getting to the core of what the problem was. EFT kept coming up, and I thought, right, it's something I can do. I can go and see someone for, but it's also a practical tool that I can carry anywhere, and I don't have to take time out. I can just, you know, do it. So I thought, right, I'm going to look at EFT. So I googled EFT Edinburgh, and yourself came up. So we had a very brief conversation on the phone, and I remember you saying within about under a minute, you mentioned post-traumatic stress disorder, and I dismissed it. I thought that's something really serious. That's something veterans get or something. So our telephone conversation was cut short thanks to my children. So I went away, and then it just started ticking away in the back of my mind. I thought, Then I did some look around on the internet at the symptoms, etc., and I just thought, she's right, it's post-traumatic stress disorder, which is why I've never experienced anything like this before and why I'm feeling like I am. The thing for me is that everything you said was so practical. It made sense. It was accessible to me, because the first thing you did was show me how the brain worked, which I've got a bit of knowledge about anyway, but how we hold our emotions, how we hold our feelings, and especially when you're talking about specific traumatic events, how the body and the brain holds that event. And because I'd been through it, it just made perfect sense to me. And it was just the most shifting experience I've had.